During your pregnancy, you've done everything you can to give your baby a healthy start in life. And soon it will be time for your baby to be born. Leaving the warm, protected place inside your body will be a big change for your baby. However, there's something special you can do to help your baby through this transition. It's called Kangaroo Care. It's simple, it's completely natural, and it's good for both you and your baby. Kangaroo Care, sometimes called skin-to-skin contact, is a special way a mother holds her newborn baby immediately at birth and throughout the postpartum period. Your baby is placed on your chest, wearing only a diaper and a hat, and covered by a blanket. This special way of holding your baby after delivery has been practiced for centuries and is the most natural and best way to care for your newborn baby.
Within about a minute of them placing her on my chest, she just calmed down and just started looking around and looking at me, and it was really just an instantaneous bond.
Kangaroo Care has so many benefits, I think, because it automatically sets up the relationship between mother and baby. She gets to feel her baby for the first time outside of her womb, and the baby gets to get to know its new environment next to somebody that she knows. She's known for 9 months and she's been inside, and the Kangaroo Care helps her to get to know her new environment without it being so harsh.
Healthcare providers recommend that all healthy babies be held in Kangaroo Care because this is the best care for your baby.
In the delivery room, Kangaroo Care is the natural place for your baby to adjust smoothly to the outside world. When held in Kangaroo Care, your baby will be warmer, breathe easier, stabilize his heart rate, be calmer, feel less pain, and cry less or not cry at all. This will help your baby sleep more soundly. Kangaroo Care helps with breastfeeding. Babies latch on much more successfully. They feed better. Mothers are going to be much more successful at breastfeeding and will breastfeed for a longer period of time. Breastfeeding offers greater protection for your baby against sudden infant death syndrome and childhood leukemia. Not breastfeeding increases your baby's risk of getting colds, the flu, developing asthma, having allergies, ear infections, and developing diabetes or obesity later in life. The benefits to mom are a decrease in your baby weight. You'll also have a decreased risk of breast cancer, obesity, diabetes, and heart attacks. The bond that happens between mother and baby during that golden hour right after delivery is incredible. These babies have the opportunity to be on their mother's skin to skin, hearing their voice, hearing their heartbeat, and feeling their body temperature. Mothers that kangaroo their babies in the delivery room have more confidence in caring for their babies and have less postpartum depression. Mothers also bleed less and have much less pain after delivery when they hold their babies skin to skin.
How does Kangaroo Care happen? Right after your baby is born, a warm blanket will be placed on your belly and your baby will be placed on the blanket. The nurse will dry him thoroughly and put a cap and a diaper on him. Then your baby will be turned over so that you and your baby are skin to skin, or belly to belly, and both of you will be covered with warm blankets. As much as possible, all care needed for you and your baby will be done while you are in Kangaroo Care. Getting to know your baby immediately following birth is so important. He will be comforted to hear your heartbeat, your voice, and feel your touch. Very quickly, your baby will become alert and begin looking at you. His sense of sight, smell, and taste will guide his natural ability to seek and find nourishment. And you will see him searching for your breast, turning his head side to side, and using his hands, his cheeks, and mouth to find the nipple. As your baby takes his very first and most important feeding from you, you will feel proud and confident that your baby has received the best start in life.
The decision to breastfeed is one of the most important decisions that you can make for your child. The antibodies that are passed from mom to baby and that first immunization that baby gets from mom just cannot be replaced in any form. However, we still have moms that choose to formula feed even though we know breastfeeding is best, and we want those moms and babies to take advantage of Kangaroo Care as well. Babies are born knowing how to breastfeed, so when they come out, they're going to look for the breast. So moms that are formula feeding and doing Kangaroo Care, don't be surprised if your baby latches on. If baby nurses once or twice, that does not mean you have to continue breastfeeding if you choose not to, but just know that baby is going to be looking for the breast.
Mothers who deliver by C-section can and should Kangaroo Care as well. Your baby will be reunited with you while you recover. It's just as important for mothers and babies delivered by C-section to benefit from birth Kangaroo Care. Mothers feel less pain and babies transition easier. In case of a delay, Dad or your support person can play an important role until your baby can be returned to you.
I had a C-section and I was concerned at first as to whether I could do Kangaroo Care in the recovery room. But sure enough, once we had him, they brought him right to us and laid him on my chest, skin to skin, and it held him there for as long as I wanted. It was a wonderful bonding experience.
In order for you and your baby to get the full benefits of Kangaroo Care in the golden hour immediately following birth, your family and friends must understand the importance of you and your baby being skin to skin with no interruptions. So don't hand your baby to family members or friends during this time. Keeping your baby warm by holding him skin to skin is so important right after the delivery, because cold babies can get sick. The nursing staff will assist you in placing your baby in Kangaroo Care during designated hospital quiet times. At your request, the hospital staff and visitors will be asked to honor your wishes and step out of the room so your new family can rest during quiet time. This can be a special time for you to bond with and breastfeed your baby. This is also a great time for Dad to bond with the baby by holding him skin to skin while you shower or rest.
Quiet time was really nice because it was a chance for me to say, okay, everybody, it's time to go. It's time for me and Elizabeth to have our time. And, I didn't even have to say it because it was kind of said for me. And so everybody left, which was really nice because we were both tired and everybody wants to come visit the new baby, and so the quiet time was great. It really helped.
There are other times when Kangaroo Care can be particularly helpful. Some of these are warming your baby after baths, especially the first bath, calming your baby when he's fussy, comforting your baby during and after painful procedures, at least 1 hour before any feeding, and when breastfeeding problems arise. You and your baby should continue to Kangaroo Care while you are in the hospital and when you go home.
I would definitely recommend Kangaroo Care.
Kangaroo Care is very easy. It's natural.
Just that moment when they brought her to me and put her on my chest, that just meant the world to me. It was the most profound and beautiful experience of my life.
Talk to your healthcare professional about Kangaroo Care for you and your baby.